Good afternoon, everyone. Thank you for joining us today. A quick time check. It's 4 p.m. in Singapore and 3 p.m. in Lao PDR on the 21st of July, 2021. It's with great pleasure that I welcome all of you to the second webinar in the series on adolescent health and development, co-organized by the Sing Health Duke-NUS Global Health Institute, SDGHI, and the United Nations Population Fund, UNFPA, in Lao PDR. I'm Shreya Goramurthy, and I'm a research associate at SDGHI. Today, we're gathered for the second webinar on adolescents in the digital environment, where we will be talking more about the risks and benefits of technology on teenagers in the region. For this, we have with us experts in the field of adolescent health from Singapore, Laos, and Indonesia. A few quick housekeeping rules to note before we move ahead. As you know, this webinar is being recorded. Please do keep yourselves on mute at all times and feel free to send in your questions using the Q&A tab below. The questions will be addressed at the end of the session after the moderated panel discussion. Before we find out more about the speakers today, I'd like to introduce Dr. Courtney Davis, who will be moderating today's webinar. Dr. Davis is a co-lead for the Education and Training Core at SDGHI, as well as an adjunct assistant professor at Duke-NUS and a staff physician in the Adolescent Medicine Service at KK Hospital in Singapore. She has a clinical focus in adolescent medicine, including restrictive eating disorders, obesity, and adolescent risk-taking behavior. Dr. Davis, thank you for joining us today, and over to you now.
Thank you so much, Shreya. I'm delighted to be here with all of you guys this afternoon to discuss a topic that is quite important, which is the use of digital technology in the promotion of adolescent health. While adolescents have always been considered digital natives in that they have great facility and extensive use of technology, certainly over the past year and a half with COVID-19, we have seen the technology use by adolescents accelerate rapidly. We are so fortunate today to have 4 panelists who are going to talk about their experience working with adolescents and the use of digital technology as a tool for health promotion, as well as promotion for general well-being and education, but also discuss some of the drawbacks and concerns that have come with this increased technology use. Each of our speakers will give a short talk, and then this will be followed by a moderated discussion. If you have any questions that you'd like to ask the panel, you can put the questions into the question and answer chat box. First, we are very fortunate to have Dr. Daniel Fung with us today. He is a child and adolescent psychologist and also the CEO of the Institute of Mental Health in Singapore. He is an adjunct associate professor at all 3 medical schools and is the president for the International Association of Child and Adolescent Psychiatry and Allied Professions, as well as the president of the College of Psychiatrists Academy of Medicine, Singapore. Dr. Fung has co-authored over 200 peer-reviewed research papers, books, and book chapters. He is also married to Joyce, the father of 5 grown children, and has recently become a grandfather. And he continues to enjoy his 3 R's, reading, writing, and research. Thank you so much for speaking with us today, Dr. Fung.
Thank you, Courtney. And I will quickly get to my slides because it's a very nice and kind introduction, but I know that my time is limited. So, and I'm going to try and keep to 10 minutes, even though I have 13 slides. So the topic I have before me is adolescence in the digital dimension. And of course, you can play around with that word and say ADD, you know. But I'd like to think that this is an important phase of life that really adds to the next generation, and adolescence can be a bane or a boon. So let's quickly look at this generation of young people. In the digital world, Singapore is kind of well placed because we're one of the most digitally connected in the world. But at the same time, in such a digitally connected world, what is the children growing up in? Many young infants even and children are exposed to screens and electronic IT very early in their lives. Not like the current generation. We call ourselves digital migrants. The children that grow up today are digital natives, and many of the adolescents are like that. And as digital natives, the digital world is at their beck and call at all times. And the question is really, how do you find the balance? Is it about timing? Is it about space? Or how do you use the digital world and in a balanced way so that you have a full and complete life? Well, one of the things that we started to do in the schools, which is where young people grow up, is really to talk about cyber wellness in the sense of the ability to interact in the digital space with the same kind of values that we'd like in real face-to-face interactions. For example, respect for others and for yourself, be safe and responsible, and to exert positive peer influences. And this is an important principle because, as can be seen in, this is a survey done in OECD countries. I'm not sure if you can see it. It's a small slide, but you can see over the years, between 2010 to 2017, more and more negative influences have been emerging online. For example, sexual images, being bullied, having bothered by online experiences. So the online experience can be a good thing or it can be a horrible thing for a young person. And in fact, in the survey of parents and teachers, this is a Google survey, a lot of parents realize that kids need digital literacy skills, but at the same time, they need to know how to handle it. How do you prevent cyberbullying? How do you maintain privacy and security and be screened away from inappropriate content so that it potentially could negatively influence them. So apart from the digital world influencing a person's values and a young person's growing up phase, there are clear physical health impact of the digital world. For example, the lack of physical activity, and this is a WHO study, as more young people spend time online, you find that 3/4 of Singapore adolescents are not active enough, and that is a concern. At the same time, there are issues that emerge about sexual matters because adolescence is a period where sexuality is emerging, and yet the digital world exposes them, sometimes rather rapidly, to a lot of information which they may or may not be ready for. And a young person could get themselves into serious problems with regards to pornography and what it then leads on. Amos, he is a very famous Singaporean who, as part of his narrative, he got in trouble for making certain comments online in his YouTube channel, eventually leading to his going to America and then facing some child pornography charges for some of the things that he's done over there. And here's another famous YouTuber, a DJ, Dkosh, who's under investigation for allegedly sexually harassing teenage boys. So the sexuality, which is an important part of development, becomes an issue because of the widespread nature of the digital world. At the same time, there are the risks of various kinds of addictions which the digital world presents. So apart from the usual addictions that we're familiar with the young people in terms of smoking or drinking, there is the issue of gambling online, of playing games. And in fact, gaming becomes quite an issue. We studied this some time ago, more than 10 years ago. We did a longitudinal study where we studied young people over a 3-year period. And what we found is that there's a group of young people who will progressively become more addicted to gaming. And the result of which becomes a social issue because they will stop going to school and so forth. And a lot of people assume that this is because they might be developing some mental health issue, but the key thing is really what we've discovered is that the more they game, the more likely they are to develop mental health issues. And the one clear factor that differentiates those who increasingly game online versus those who are able to moderate and eventually reduce their gaming time is the monitoring by adults. Also, in the digital world, there's a lot of what we call violence victimization. Now, if bullying is something that's important, well, in Singapore, apparently we have very high rates of bullying. This is variable. I mean, it ranges from 10 to 20% depending on the studies that have been done. And in terms of, in Singapore, we've done a study on bullying by the Singapore Children's Society, quite a number, 1 in 5, which is about 20%, or 1 in 4 in secondary school, which is 25%. Alongside that, there is cyberbullying. And in this cyberbullying study that was done with IMH and the Children's Society, we actually found the numbers of cyberbullied are about the same. So in this second study, the rates weren't as high as in the first study, where it's 1 in 4, it was 1 in 9. And there was a balance between cyberbullying and traditional bullying. So bullying does exist even in this digital world, and there's a risk. Of course, in terms of mental health and suicide, Singapore had one of the highest rates it ever had in the last year in 2020, and young suicides are a concern. There is a trend that suggests that suicides are on the rise, particularly in males. And of course, I don't have the latest data. This is data from previous studies that suggest that falling from height, 50% of young people leave suicide notes, and that the issues are concerned related to school or study stress. And the risk factors for the young person are actually life events rather than mental illness per se or physical illness. Life events for the young person could be exams, relationship issues, family breakdown. All these issues have an impact on the young person and actually lead to suicide. So what are the positive aspects of the digital world for the young? Well, in the past, face-to-face consults were the thing. And then we had to bring in the whole family, and sometimes it's complicated. But now with the digital world widely available, and the fact that we can have this talk here online shows that we have a lot of space for mental health services, tele-collaboration, tele-treatment, tele-monitoring, and tele-support. That is all done remotely. And this whole space of telehealth is actually a possible boon for helping young people, and we should leverage a little bit on that. In fact, for the mentally ill, therapies, for everyone's good mental health, technologies, and it ranges from fully supported, and somewhat automated, particularly along the realms of mental health. And what do I mean by that? Well, in therapy for illness, we often need face-to-face, but sometimes we can add on a tele component that will allow a young person to seek help earlier, get in touch with their therapist, and so forth. And it also allows us to use technology to gamify and make it interesting to help a young person. With regards to the general population, where we're talking about mental health issues and supporting them and coping with the stress of life, somewhat automated self-help might be helpful. In Singapore, we started a mindline.sg. If you go online, you can find this chatbot that does some of this. Some of it, of course, can be in terms of purely playing games. And since gaming is such an addictive thing, can we turn games into positive areas of supporting young people? And then, of course, robots and automation might be the way forward for the broader population. Because mental illness in the young, probably at most 1 in 4 to 5, but the rest of the young people, they also sometimes need support, particularly in situations where life events impinge and give them some degree of stress. So if you want to know more, here's a little advertisement on the Singapore Mental Health Conference, and we also have a child and adolescent mental health conference at the World Congress, which is in Dubai, but it's going to be a hybrid congress. So please go online and look at this. Thank you very much. I tried to keep to my time, and this is my family, as I promised to show you, including my grandchild. Thank you very much. I'll stop share over here. Keep to my time.
Thank you so much, Dr. Fung. Our next two speakers join us from Lao PDR. First is Dr. Tej Ram Jat, who is a program specialist in adolescent sexual and reproductive health and the team lead for the youth team for the UNFPA Lao PDR country office since 2018, where he leads programs on empowerment of adolescents and young people with a comprehensive ecosystem approach. Prior to his current role, he led planning and management of large-scale projects on adolescent and young people's health and development and public health capacity building in both India and Myanmar. Additionally, we have Ms. Ketsana Siphonephat, who is the Deputy Head of Academic Affairs at the Lao German Technical College, the Department of Technical and Vocational Education and Training, the Ministry of Education and Sports, Lao PDR. She graduated from the University of Laos with a master's degree in education administration, and she also received training on managing gender issues in complex societies from the Institute of Public Policy and Management, University of Malaya, Malaysia. She has contributed significantly in developing the curriculum for comprehensive sexuality education for TVET students in Laos, and she is currently playing a critical role in capacity building of teachers as a member of the central pool of trainers and ensuring the quality and the delivery of comprehensive sexuality education to students in Laos, and is a member of the supportive supervision team of the Ministry of Education and Sports. Thank you both for joining us today.
Thank you so much, Dr. Courtney. Good afternoon, good morning, friends. I and my colleague Kate, we will be sharing our experiences of delivering adolescent sexual and reproductive health and comprehensive sexuality education in Lao PDR using digital technology. Some of you may already know that Lao PDR is a landlocked country with over 7 million population, and we have around 50 different ethnic groups in the country, so a diverse population. And Laos population is one of the youngest populations in the Southeast Asia region. We have over 50% population below 25 years of age, and around 21% adolescent population is in Lao PDR, which makes Lao PDR a case for potential demographic dividend if we are able to provide education, empowerment, and decent employment to these young people in coming 2 decades. However, adolescents and young people in Lao PDR face different vulnerabilities and challenges. If we see the adolescent sexual activity, around 29.7% adolescent girls and 21.8% adolescent boys in 15 to 19 years have already started sex. But in terms of contraception use, only 29.1% currently married adolescent girls 15 to 19, and around 14% boys who are unmarried, they are using contraceptives. And there is very high unmet need for contraception. Among married girls, it is 17%, but for unmarried girls, it is 73.9, which is very, very high. And adolescent girls in Lao PDR who are in the age group of 15 to 19 years, 42.6% are anemic. Around 41% are out of school, especially at the secondary level. 23.5% adolescent girls are currently married or in union, though we have a law which prohibits marriages before 18 years of age, but still a quarter of adolescent girls are getting married or starting union. Adolescent birth rate in Lao PDR is highest in Southeast Asia region with 83 births for every 1,000 adolescent girls 15 to 19 years. And this is a especially serious challenge because 43% maternal deaths are among adolescent girls and young women who are in the age group of 15 to 24 years. And all these challenges and vulnerabilities are further exacerbated because of the COVID-19 pandemic. We see the increased risks of gender-based violence, unplanned pregnancies, child marriage, school dropout, child labor, mental health, psychosocial issues, as Dr. Fung also mentioned, the young people facing in Singapore. Lao PDR also, young people are facing the similar challenges because of the COVID-19 pandemic. The mobile, internet, and social media use is increasing very sharply in Lao PDR. Around 79.1% population has mobile connections, 48.4% population is using internet, and 49% population is active social media users. And a large proportion of these social media users and internet users is adolescents and young people. This increase is very sharp, as you can see that during last 1 year from January 2020 to January 21. The mobile connections increased by 7.7%. Internet users also increased by 15.2%. And active social media users also increased within 1 year by 16.1%. For addressing the challenges and vulnerabilities of adolescent girls, we have developed NOI 2030 framework, which is adolescent girls-centered programming approach. Comprehensively, we are addressing the issues. We have put adolescent girls in the center. We created this graphic character NOI, who represent all adolescent boys and girls. And we aligned this framework with Sustainable Development Goals by selecting 5 Sustainable Development Goals, which are the most relevant for adolescent girls and young people. And around those 5 Sustainable Development Goals, we are creating an ecosystem for NOI, where we are advocating with different stakeholders for increasing investment in adolescents and young people. We are developing new policies for providing a policy favorable environment for young people. We are strengthening reproductive and sexual health services, working with different stakeholders for addressing gender-based violence and male engagement and improvement. We are providing comprehensive sexuality education in schools, where we are also using digital technology. And we are also working on out-of-school community-based interventions for empowering adolescent girls, sensitizing parents and communities, and improving financial literacy. In all these interventions, we are also building the component of evidence and data so that we can understand the situation and use that for the programming. We are also engaging young people for taking action on the issues which are affecting them and their communities. And we are engaging different partners through partnerships. For the CSE and other experiences, now I would like to invite my colleague Kate. Kate, please, over to you.
Thank you very much, Tej. Now I would like to share you about CSE in Laos through curriculum-based approaches of the teaching and learning about the cognitive, emotional, physical, and social aspects of sexuality with the system approach based on incremental human rights approach, age and developmentally appropriate, gender equality, national curriculum-based culture, and developing life skills needed to support health choices. Next, please. The process of the scaling up CSE based on the national commitment at ICPD 25 Nairobi Summit to integrate CSE in all curriculums nationwide by 2030, included in education and sports sector. Development plans focus on the primary school, secondary school, TVET, teacher training college, and the key concept and content included relationship, value, right, culture, and sexuality, understanding gender, violence, and staying safe, skill for health and being well, human body and development, sexuality, sexual behavior, sexual and reproductive health, safe use of ICT, internet, and social media. The system's approach for develop the curriculum, then train the teachers, and CSE delivered to students through participatory methodology by using the innovative tools and technology, and also expanding delivered through the partnership. CSE in primary is integrated into the national curriculums and delivered in all primary schools across the country. For the TVET and secondary school, we deliver together by starting from Vocal, Udomsai, Vientiane Capital, Sieng Kuang, Mopan, Savannakhet, and now we are on the process to 4 provinces in south of Laos, Champasak, Salavan, Attapeu, and Sekong. And these are some activities we have done in the province. We have digital tools and platforms such as Yahoo on mobile phones. Here, the young people can find the question and answer about CSE. These applications, they can read or click to listen CSE information. And here also have some contact and site link for more information if adolescents need more information. Ministry of Education and Sport provide Khang Yak Hu Lao web platform and mobile app to share software copy of course, textbook, learning material, comprehensive sexuality education videos, guidebooks, and learning materials on online safety, learning material and exercise on online safety, and safety use ICT, guideline and material for the capacity building of teachers. And CSE delivered through a series of video online and on education and sports TV channel, and also through live programs on LYU and CIR radio channels. Another way to provide information about CSE is Hug Me Pen online platforms for adolescents and share. Next please. And share another ways to support them, such as the hotline number for male and females to help them about their health and social issues, and they can talk about their problems through WhatsApp, help telephone number, and helplines, and so on. Yes, thank you very much. ขอบใจหลายๆ
Thank you so much, Ket and Tej, for such a very interesting presentation. Our final speaker today, before we go on with our moderated panel discussion, is Ms. Ticiana Garcia-Tapia, who is a youth and adolescent development specialist and gender focal point at UNICEF Indonesia. She's worked for UNICEF since 2013, initially in the South Sudan, and since 2016 in Indonesia. She was the program lead in Jakarta and has been working on adolescent participation in education reform programs for 14 years. Prior to joining UNICEF, Ticiana worked for the OSCE in the Western Balkans on peace building in education, and for an NGO in South Sudan working on education in emergencies, life skills, and girls' education. Thank you so much for joining us today, Ticiana.
Thank you so much. Thank you so much for having me. So hello, everyone. Here, if we could go to the next slide. Just want to put forward a little bit of a provocative slide here. I know that very often we talk about digital technology in a very positive sense. And I think in the same way that Dr. Paul has spoken about some of the risks and some of the hidden, especially the hidden risks, it's really important to highlight the two sides of every story. So we know that from recent research and consultations with young people, there are many vulnerabilities affecting young people and children and their lives online. And among those risks are, interpersonal skills being affected, mental health, cyberbullying, all of which were highlighted by my fellow panelists, isolation, lack of physical activity, concentration issues. And some might say that this so-called iGen is the most depressed in history. If we could go to the next slide. As some of my panelists have already said, us adults are really digital migrants, but these adolescents that we speak of are really digital natives. And we know that young people are increasingly growing up in environments with really some level of technological familiarity, and in many cases, a very advanced level. Because of this, they have the capacity to learn and adapt to digital learning far more quickly than other generations before. Teachers, on the other hand, have reportedly been struggling to make the transition from offline to online learning. The way they understand digital literacy impacts the way students learn. And of course, we know that it's not enough to be able to use a device. It's not enough to be able to to know how to use Zoom or other platform, but it's really the way you teach online that's important. If we can go to the next slide. So here's some government data that we have that we use regularly in our work. Access to the internet in Indonesia has been growing steadily in the last 6 or 7 years, and it looks like it's on track to achieve the SDG target by 2030. So as according to the regular data collected by government, Susanas, 77% of youth, and that's youth 15 to 24 years old, have access to the internet. If you look at the second graph, in terms of schools' access to the internet, the Ministry of Education tells us that 35% of primary schools and 49% of junior secondary schools. If you look at 69% of senior secondary schools and 76% of vocational schools have access to the internet. So as you can see, access grows with the levels of education. But of course, access isn't everything. And as I said before, little data exists on actual measures of digital literacy, and the government has yet to develop a framework to measure progress, both for children and adolescents, students, learners, but also for teachers. We could go to the next slide, please. So who's being left behind? As you know, in UNICEF, we really focus on applying the equity lens, and we really want to make sure that in this fourth industrial revolution, in all of the learnings that we're gaining from the working, living, and learning within the COVID-19 pandemic, we don't forget the most vulnerable. So while the overall penetration of internet among young people and among schools is quite high, these figures, in fact, mask significant disparities that exist among regions and socioeconomic groups in Indonesia. I often say that Indonesia, more than a country, is a subcontinent because it's 270 million people, 17,000 islands, 3 time zones, a lot of young people. It's really, really a subcontinent. And the data tells us that although there doesn't seem to be gender differences in access to the internet, for now, based on the data that we have, there exists large gaps between urban areas and rural areas, people without disabilities and those with disabilities, wealthy families and poor families. And of course, between the more advanced and urban provinces such as Yogyakarta and easternmost provinces such as Papua. So this is really some of the data that we have, and it's one of the big areas that we're lacking in, because up until now, the dependency on technology for learning, for employment, and for connection was far less. And of course, this has been greatly affected by the COVID-19 pandemic. In Indonesia, schools have been closed for over a year, and it has had significant impacts. If we could go to the next slide, please. So as I said before, it doesn't seem to have a massive impact when it comes to gender. However, our colleagues at ITU do regular research pieces. And the one from last year on measuring digital development tells us that, in fact, half of the total global female population is still not using the internet, compared to 42% of all men. And in the past decade, we know that the internet user gender gap has grown from 11% to 17% in just 6 years. And this remains largest in the world's least developed countries, which stands at 43%. What we also know, and which is very, very concerning, is that female youth aged 15 to 29 are 3 times more likely to be not in education, employment, or training, otherwise known as NEET, compared to their male peers. And of course, this has an impact in terms of access to devices, internet, but also in terms of learning new skills that you would need in this technology. If we can go to the next slide, just to give you an overview of the impact that the COVID-19 pandemic has had in Indonesia. As soon as the situation got worrying, distance learning was started here in Indonesia with either closure of schools or certain school protocols, guidance on home-based learning, flexible use of funds, and an emergency curriculum. If you go to the next slide. We know that there's a wide variety of learning platforms here in Indonesia. The EdTech ecosystem is really quite impressive. But what does remain is that most of the accessing and most of the utilization of these platforms still is really linked to urban areas and areas with high-speed internet. In areas that did not have that access, TV and radio programs were started to reach kids. But on average, we found that children were not spending as much time on learning and were really struggling with new material. Printed materials were also made available in a sort of database of materials that teachers and students could access, but of course, once again, very much linked to availability of devices and internet connection. Go to the next slide. So based on monitoring reports by Indonesia's Basic Education Working Group and consultations with young people for the last 18 months, what do we know is that there is a very big digital divide in Indonesia. We know that children and adolescents have been feeling very anxious about missing out on learning. They miss their friends and their peers. They have found the transition to remote learning very, very difficult. And what the research shows is that there is a very big gap in terms of skills, connectivity, and available tools for online learning. So not tools that can be downloaded and read and self-study, but really tools for online learning. What we also know is that less than 20% of teachers in the last year reported using interactive apps like Zoom or Google Meet. So most of the teachers are utilizing WhatsApp to communicate with children and families. And what ends up happening is that it's a very one-way process where they get sent a series of activities, they complete them, and they send them back. But there isn't that interactive exchange that would happen in the classroom or with their peers. Over a third of children reported boredom and concentration as main, or lack of concentrations rather, as main challenges of learning remotely. We also know that 35% of children had poor or no access to the internet. Less than 15% of rural children have computers for home-based learning, while 25% of urban children do. In many cases, they share these devices with family members, so they do not have access to them for the entire day. In terms of social norms, we know that young people are treated as passive recipients of interventions, and when consultation does occur, the topics and modalities are tokenistic. Spaces for participation are perceived to be shrinking. So in other words, as I said before, very one-way learning and very little opportunity for discussion, for brainstorming, and for creative exchanges. And this has been highlighted by young people as a very, very big challenge, especially during the pandemic, or rather that the pandemic has made it much worse for them. We could go to the next slide, please. So young people have been part of many consultations that UNICEF Indonesia has done in the last year for us to better understand what are the main needs that they themselves have identified, and to ensure that our programs are a lot more responsive and sustainable. So what they've told us in brief is that they feel that although being online is part of their life, they still need opportunities for live social interaction, and that they continue to be very worried about online safety. They don't feel they have the skills or the knowledge to really be prepared to deal with that. They also told us that they felt that teaching systems are not ready for going fully online, and they feel that it is absolutely urgent to train teachers to be able to deliver with new technologies. They want access to reliable internet, devices, soft skills in the curriculum, and more of an enabling environment for learning. They also want better platforms, less formal, to learn about digital technologies, 21st century skills, and to be able to collaborate more freely with their peers. Go to the next slide, please. So this is a little bit about what UNICEF at the global level is doing to address this. There's a global initiative called Reimagine Education, and it has these 5 components around world-class digital learning solutions, engagement of young people, availability of devices, zero rating, and connectivity. And it's really to have a pro-equity approach, working with tech providers and solutions that are appropriate for all contexts, all literacy levels, all connectivity, to co-create with educators and young people to produce localized, contextualized, and relevant content, and to have real-time feedback loops to enable course correction. This is a global initiative that is currently being contextualized to different countries across the world, identifying which are the priorities and where UNICEF's added value is. So that's it from me, and I'm open for any questions that you may have. Thank you so much.
Thank you, Ticiana, for a very interesting presentation. All right, so we're going to switch to the panel discussion and question and answer portion of the discussion. And what was I going to say? We will also take questions from the audience if you have any questions. So I guess to start, I'm just wondering, what do you all see as the key lessons that we can learn from each of these three countries, Singapore, Laos, PDR, and Indonesia? And how do you think they can be applied to other parts of the region? Yes, Ticiana?
Thank you so much. I think really one of the things that we've learned is what I mentioned earlier, the issue of contextualizing, so that one size really doesn't fit all, and that the more you consult with both the users and the duty bearers, the more effective the materials, the programs that you design will be. And that's really something that I know that most of us as practitioners do recognize that, but of course that takes time. Sometimes it has budget implications, but we feel that it's really been so worthwhile to do that. And a lot of the countries in our region might come across as being quite homogenous, but when it comes to learning and when it comes to applying technology, they really aren't. So really not just your classic research or evidence generation, but really engaging young people and teachers and parents to really understand what their needs are. There's so many hidden risks and hidden vulnerabilities that are so difficult to assess. It's really worthwhile to do so.
Wonderful. Tej, you have something to add?
Yes, I would like to add that, yes, we had very important insights and lessons from all three countries. The one thing that we can use this technology for reaching out to more and more young people who are left behind, we can access with limited resources. The second thing is regarding addressing the barriers, because there is a huge digital divide based on rural urban areas, poverty, gender, or ethnic groups, and those rural residences. So we need to keep in mind that leaving no one behind approach and reaching the furthest behind first. And the third thing, the technology is helping us in providing information, counseling, and services, but it is also coming with added risks. So young people have risk of anxiety, mental health, stress, and online cyberbullying. So we need to create appropriate mechanisms with safeguards so that we can ensure the protection of young people from these risks. And many countries, not only these three countries, but many other countries in the region also have similar situations. So these lessons could be useful for other countries. Thank you.
Thank you, Tej.
Well, I suppose just to add to the points, I think actually in ASEAN, amongst all the WHO regions, actually we have the most number of prototypes for using telehealth to a large degree. About 10 years ago, there was a paper that was published by WHO, and I suspect we in our region. ASEAN and around us, actually there is a lot of interest in using digital means for a variety of activities, not just education, but healthcare and so forth. And I think there's a need to sort of meet together and discuss the potential, much as we also know about the risk. I think it's this ongoing discussion that will be helpful, and then not just amongst healthcare, but also amongst educationists and also social workers and community agencies.
Wonderful. So, I mean, we've talked a lot about the sudden digital shift that we've seen over the last year with COVID-19. How are adolescents in each of these three different countries coping and responding to this sudden shift?
Maybe I can start. I think what's interesting, at least I showed that slide about Singapore's suicide numbers. That is just the absolute numbers, not the rate. The rate has also gone up. And around our region in East Asia, not just Southeast Asia, suicide rates appear to be on the rise. And of course, suicide itself is a kind of an indicator of emotional distress, not necessarily mental illness, particularly in the young, as I've shown. Life events have a greater impact. the pandemic seems to have a greater impact. And the question I have, and I don't know the answer, just a question, is whether collectivistic societies like ours are much more prone to social isolation and the social distancing that occurs as a result of a pandemic like this, whereas more individualistic societies cope better for whatever reason.
Thank you. That's those are very important points. Ticiana, can you add anything from the perspective of Indonesia?
Yeah, very similar to what Dr. Daniel has said. Mental health has really come up very strong as one of the biggest challenges that young people face. But on one hand, it's as with many countries, the stigma of mental health, the lack of, let's say, unbiased information, and the lack of safe spaces to discuss this. So that's still an area that is growing in Indonesia. And in fact, what we're seeing is that there's a lot more youth-led movements and organizations and services that are becoming much more accessible to young people who don't feel that they can talk about things. The other thing that has really come out is this sense of loss. So there's a lot of young people that feel that they're missing out on opportunities, that their future will be impacted, but also that when they had to move to fully 100% online life, they didn't have the skills to do so. And I think that's really been a shock to the system. I'm sure that's the case in many other countries. Thank you.
Yes,
Thank
and
you.
I would like to add that similarly in Lao PDR, also the adolescents and young people, they are using more technology for accessing online education, health services, counseling. But then there are also these increasing trends of anxiety, mental health issues, stress, trauma, depression. And also we started these telephone helplines with our partners, Lao Youth Union, Lao Women's Union. And we have increasing number of calls from young people where they also share request for support on the issues related with sexual harassment, cyberbullying, and sexual exploitation. So those issues are also coming. So in this situation, we need to work more for raising awareness among young people for using ICT safely, and also working with the caregivers and the support system so that we have appropriate system in place. Thank you.
We've started to have some questions from the audience. One of the questions that I thought was a really good one, which was in working to address issues with the adolescent population, it's also important to engage with families as well. And I'm wondering what is being done in different programs in different countries to also engage families. And while the adolescents may be digital natives, the parents are often still digital immigrants. So are there any sort of challenges faced with that?
Okay, well, I'll talk a little bit about this. I think in Singapore, we focus a lot of our parenting programs on the younger population, children in primary school, as opposed to parents for the adolescents. I think more needs to be done. The parenting aspects and the relationships that need to be built for young children versus adolescents are quite different. And there is a pivoting that parents need to do as they have a young person in the family, and how much do you allow for freedom, personal freedoms and liberties, and also decision making versus a young child. And I think that is sometimes not well coordinated because parents tend to get very involved when the children are young and they go to the schools but as the children grow up and they start attending secondary school and beyond, parents tend to either may not get as involved, but at the same time not be aware of what is going on. So I think that integration with school and community life for the young person probably needs a bit of work. There are parent support groups in all the schools, but the the activities that they do and the parents who participate, they are the converted, they are the parents who know how to deal with adolescents already. They know a lot, they just want to share that information. There are groups of parents who don't get involved. And that has to do with the life cycle of family. And in the life cycle of family, when you have adolescent children, parents sometimes, when there are family pressures, and particularly in this pandemic, whether it's financial or relational in nature, that's when problems arise. So it is a difficult situation, helping parents and families during this period.
Thank you. Ticiana, do you have something to add?
Just to add quickly that we've just, as UNICEF, we've just published a resource that I will share now in the chat box on parenting adolescents programming guidance, and that's to really help practitioners when they plan programs. Because one of the things that we've identified is that the guidance that exists for parenting really focuses on younger children, and whatever is available for adolescents tends to be very punitive, very restrictive, and not really promoting the positive development that we know our adolescents need. The other aspect of it is that, of course, in some countries, especially in this region, there are many adolescent parents themselves who also need very tailored guidance. So I've shared it in the chat box for anyone who'd like to access it. It's available for public use.
Thank you. That's a great resource for all of us. Tej, do you have something to add?
Yes, I would like to add apart from the issues mentioned by Dr. Daniel and Ticiana, that now parents are also facing the challenges of the COVID-19. So in this situation, we need to work with them, and we are in fact working with them. There are issues related with girls dropping out from school after the lockdown. Girls are being married off because to address the economic challenges of the families, because parents, they have lost family income, they have lost their jobs and all those issues. So in this kind of situation, we also need to work more with parents so that the issues of adolescents are addressed at the family level, and then we provide them support like cash assistance and then social protection support and other things. So that is very, very important. Thank you.
Thank you. Thank you. We have another question from one of our audience members, and I'm going to start by directing this to Dr. Fung, just because it's well relevant to all countries, is talking about some recent news in Singapore. As a parent and medical professional, we've been quite shaken by the recent news. There are a lot of talks about the impact of HBL on mental health. Any advice on policy settings?
Well, I think when it comes to policy, it shouldn't be reactive to incidents or things that happen. Policy setting really is about thinking about, ideally, well ahead in time. How is society evolving? What needs to be done to support that evolution of our society? And I know that what the questioner was alluding to, we've had a very recent incident in which a young man, 16 years of age, had killed another young person, a 13-year-old, in school. Of course, the events is still unfolding. We are only hearing about the news and the details. What I want to say is that as our societies globalize and we get more and more bombarded with media and social media, there is a risk. A few months ago, we had a young person who was radicalized on the internet because of just reading in materials and so forth. So there are these risks that exist, and young people are vulnerable. Just as if you expose young people to pornography, not everyone will be affected, but there are susceptible individuals. We cannot also control something like the internet, just as it's very hard to control media in general. What we probably want to focus on is a integrated, and the family, the school and community, an opportunity to sort of understand the issues that are at hand, and having a system in place to follow up situations when it is risky. That I would think from a policy point of view in developing mental health services. The services have to deal with the spectrum of care from tertiary care at a high level, intensive, face-to-face in a hospital setting possibly, to right in the community, in schools and at home. How do you support families? But you don't also want to be a completely controlling environment where you don't allow people to express themselves. So that ability to create a system where people in crisis or in trouble, or when they're emotionally distressed and having problems, how do they get to help? And with adolescents, I think the key thing is not to have one way only, I think I've learned that lesson over the years. In the last 20 years, as we started to develop a lot of our services, we had a top-down approach. Today, we tend to, and I take Ticiana's point about how we need to listen to the young people about what they need, whether they would like to go to online resources, find their own help, work out with their peers, or even drop in at a community center to get the help that they need. All of this should be available and planned and thought out, possibly through the where young people aggregate, whether they're at school or in their community where they live. I think that's quite important in developing services to support young people.
Thank you, Dr. Fung. I'm wondering, from the perspective of Indonesia or Lao PDR, any thoughts on the role of policy in supporting kind of young people's mental health, either during distance learning or just more generally in the COVID pandemic?
Yes, and Lao PDR, recognizing the importance of addressing the issues of mental health and psychosocial support, the government of Lao PDR, UNFPA and other partners started these telephone helplines and also training the counselors. We are working with the National University of Laos to develop a new curriculum on addressing and providing mental health psychosocial support. So there are initiatives in Lao PDR for these issues, and in coming days, I think there will be more interventions and efforts. Thank you.
Yeah, likewise for Indonesia, that is also the case. And there's been a lot more discussion in the way that mental health and PSS services are delivered. So there's really been far more discussion than up until now. And I think that's going to be really important, especially in terms of providing, as other panelists have said, online services and more flexible services for young people.
Just as an add-on, I'd like to just, if Courtney will allow me the indulgence.
Of course.
The upstream efforts are quite important, I think, in also thinking about policy. I draw your attention to this concept that was first described by Antonovsky about salutogenesis and what are the origins of health. And, because we are very, we in healthcare are very pathogenic driven. So it's about illness, it's about problems, and it's very downstream. And if you take the metaphor of a river, two Finnish researchers actually talked about this. Salutogenesis is going upstream on the river, trying to find ways to help individuals who have fallen into this river. And if you allow the river to flow you downstream, what happens is you end up in the waterfall of death, because all rivers drive to some kind of rapids and it's dangerous. And that's the illness picture. But when you think about upstream, a lot of people then think, oh, okay, let's prevent people from falling in the river. So let's build a bridge, let's have fences, let's have safety nets. But these are the healthcare facilities, which are what we as healthcare professionals tend to look at. But the idea of salutogenesis is really to teach people, hey, wait, maybe we should teach them how to swim, right? So that they would be able to swim out of the water, and if they do fall in. And this is really about the idea of health promotion and potentially early or primary prevention of illness. And so for mental health, I think it's quite critical that we start to look upstream. And I'm going to directly then move on to one of the questions that came on, which is about sleep. So sleep would be a completely upstream issue because amount of sleep that young persons have would determine their mental health, because it's one of the determinants, in physical health that determines mental health. So again, whether they get enough sleep, and of course, digital world tends to affect that, because if you go online and you start to play games, I play video games myself just to get a hang and understand what young people go through. And it's highly addictive. And even if you're not addicted to it, you play, and you play for hours, well into the evening. So that's something to think about.
Yeah, thank you very much for that. I was going to see if we had time to answer the last question, but you have done it for me, so I appreciate that, Dr. Fung. So I think this is about the end of the hour that we have to spend with each other, talking about the role of digital technology, both the benefits as well as some of the risks for adolescents. Certainly, this whole process has accelerated significantly with COVID-19. And I think that, looking forward, we'll have to see how to continue to take some of these wonderful lessons and programs that we've heard about from our colleagues in Singapore, Indonesia, and Laos PDR, and can you continue to move this work forward in the region. So with that, I'm going to thank all of our panelists for their time and their wonderful expertise and perspective, and our participants for being a lovely audience today. And that will conclude this webinar. Thank you so much for joining us.
Thank you so much, everyone.
Bye.
Thank you.